And we're continuing our discussion of Mental Health Awareness Month tonight on the Town Hall because it's something that just affects everybody, but we just don't talk enough about it, Michael.
Yeah, and our discussion here at this time yesterday made one thing clear, that it is a serious issue here in Western New York and of course really everywhere. And joining us live to continue talking about this is Erie County Mental Health Commissioner Mark O'Brien. It is great to meet you. Thanks for coming on the show.
Thank you for having me. It's a pleasure.
So yesterday we spoke with Dr. Michael Cummings of ECMC, who talked about a big increase that he's seen in the demand for mental health services. Is that something that you've seen in your position as well, and is it something that you've been able to address?
Well, absolutely. On normal circumstances, you figure about 20% of the population have a diagnosable mental health condition at any given time. Right now, you can look at it up to about 50% of the population are having some type of mental health condition in terms of anxiety or depression, which anxiety in itself, there's nothing wrong with that. It's when it becomes something that interferes with your daily life. And with so much going on with COVID, carrying threats to your health, your loved one's health, your ability to maintain a job, so much insecurity going on there that people have been through a lot, and people have realized that they've been traumatized.
Yeah, Mark, we had this discussion during our editorial call this morning, and it just went on and on and on because everybody had such strong feelings about it. And a lot of it was centered around children. And we know the demand for children who need mental health care has also increased. I mean, kids were not used to remote learning, and they've been dealing with that so much. What is your advice for parents out there right now who are watching, and what we should know specifically about the mental health care of our children?
Well, first of all, it's important to realize that in some cases, there are many cases, kids will act out what they can't talk out. They don't always have the words, or they really can't, depending on where they are developmentally. It's hard for them to put it in the words. So, and kids, like everybody else, need a number of things. They need routine, they need security, they need a sense of hope, they need a sense of connection, they need a sense of purpose. And so the more that we can lend as adults, lend 2 ears and a big shoulder, that's going to be a big help. So if we can get them to talk, and there's really 2 types of folks in this world, those who listen to reply and those who listen to understand. So the first thing I would say to a parent is listen to understand. Let them talk to you. Help validate what's going on with them, and then look for some signs that they're struggling, whether they're feeling alone, isolated, irritable, whether you're seeing some impulsive behaviors. Are you seeing some changes in sleep patterns, eating habits, expressions of worry that you've never seen before? You know, it's really a good thing to kind of know your kid and pay attention to them, and just to be there for them. That's what's really it's all about.
It's helpful for all of us to have some of these tools, particularly with many of the mental health practitioners having long wait lists now, booking out weeks or even months. So where do you recommend people start to get help?
Well, first of all, there's something that's going on that hasn't been in place before. New York State has put in what's called Project Hope, which has been a FEMA funded endeavor that is contracted through the State Office of Mental Health and through the county. So there are now very free crisis counselors, both online and on the telephone line, and you can see in person that will come out to your neighborhood to tour your house either. So it's the New York Project Hope helpline, and that's 844-863-9314, or just Google New York Project Hope. So that's one thing, and that's really going to be in play right now, hopefully through December, and there's no cost to anybody. And the other thing is telehealth has been really kind of an upshot with what's going on with COVID. So a lot of the clinics have really extended themselves, and in some ways, for those who are suffering from anxiety, you don't have to go into the office anymore. You can do it from the comfort of your living room or your home. And so there's really, there's been a real advantage. So reach out. We are really well blessed with services in Erie County. There's a lot of great agencies and really dedicated practitioners. And I would really take advantage of them. And it's either, and in the meantime, if there's a crisis, you can either call crisis services at 834-3131, or if you have a child, there's the CARES helpline, and then you can always call 211 for information.
Mark O'Brien is Erie County Mental Health Commissioner. Thank you so much for coming on. Such an important topic. We appreciate your time.
Thank you for having me.
All right.
And thanks everybody for watching tonight. Remember, you can keep texting us your questions and your comments.